I, like many of you who are here, have trouble with your supplemental drug coverage. I went into the famous donut hole the first week of May. I'm retired. My husband's retired, but I have to keep working in my house and my garden. And I take some very expensive medications. I have 11 prescriptions, 4 of which I have to pay full coverage since May. I called last Thursday to renew a prescription that I'm supposed to take 2 times a day. She told me it would be $900. I told her I couldn't do that, that I'd have to do it monthly. And that's just one of 4 that are $200 and $300 a piece. I also have a medication that they will not pay for no matter what. It's very difficult to try and manage money for these drugs, and they are what keeps me going. I have a husband who will fall into the donut hole in July, end of July, and I'm hoping that someone, if there's enough noise made, that there will be some recompense to us. We pay for our medications out of our home equity loan. We will never get that loan paid off. And my kids say, "That's all right, Mom. We don't need the money." But I was raised in a generation where you paid your bills.
As a struggling small business owner, I was only able to afford a catastrophic health insurance policy with copays and deductibles that neared $10,000. Given the fact that I was young and healthy at the time and had never suffered any serious health conditions, I settled for this substandard health coverage out of necessity, as it was all that my young and growing business could afford to provide. So when I first noticed the small lump on my breast, denial seemed to be the only option. As most small business owners out there know, keeping our businesses viable and growing is more than a full-time job. It's a passion that requires constant work and care, and we just don't have time for health problems that we can't afford. But, as our nation has learned so painfully in the past 8 years, denial only leads to catastrophe. In October 2005, I was forced to admit reality by walking into Friedman Cancer Center for the inevitable dreaded diagnosis. But by this time, the cancer had spread throughout my body to bone, lungs, and liver. It was now classified as stage 4 breast cancer, the kind that you don't recover from, as a result of the delay in diagnosis and treatment. My chance of survival was pegged at just 13%, and my journey was just beginning. My worries, however, were not limited to my health. For weeks after diagnosis, I was in a state of near panic regarding how I would possibly pay for the treatment. I had no savings, no real assets, and no idea how to cover these monumental copays. And with this prize-winning pre-existing condition, I had no opportunity to seek a better health plan, as I was now shut out of the market. So I finally walked into our St. Louis County Medicaid office, desperately seeking help. I was fortunate to have a fabulous caseworker, Rebecca Henderson, who got right to work, and within days, I received this Missouri Medicaid card that would help save my life. Now I could walk into one of the top cancer centers in the world, right up the street here at Friedman Cancer Center, and receive top-notch care without having to sell a kidney to cover the copays and deductibles. My treatment did commence post-haste, and I'm standing here today thanks to the Missouri Medicaid program and the federal taxpayer-funded Medicare program, for which I became eligible after a 2-year waiting period. These public health plans have allowed me to receive some of the best cutting-edge care in the world, equivalent to the coverage that our senators and congressmen enjoy, without ever having to wait, without ever having to worry. elected officials are given the choice of a public plan, why shouldn't we be offered the same choice? In fact, recent polls show that 76% of Americans, including half of Republicans, support health care reform with a public plan option, and it's time that we the people have our voices heard in the halls of Congress.
I'm a small business person. I run a small real estate company, a small development company, and a small not-for-profit. Last year, my assistant's health care insurance coverage went up 20%, and that's been typical. We cannot afford this ongoing, unsustainable kind of health care cost in this country. This is not just about health care. This is about the survival of our country and the survival of our economy. The self-employed and small businesses continue to cite high and unsustainable premium increases as our top healthcare concern. On average, small businesses pay about 18% more for the same benefits as large employers pay. Let me restate that. On average, small businesses pay 18% more than what large businesses pay. And yet we, small businesses, are the economic engine of our country. We've reported that about small businesses pay 10% of their payroll costs for health care. As a result, fewer small businesses can afford to offer coverage. From 2000 to 2007, the percentage of small businesses offering coverage dropped from 68% to 59%, while large firms held stable at 99%. Many individuals switch plans, 12% drop coverage entirely. At our firm, what we did is we cut down, I gave my employee a choice actually, and what we did was to cut down the deductible, and we also cut down the amount of coverage from 100% to 80%. And we set up an internal savings program where I paid that money to my employee, so the difference in the coverage cost, so they would have that available to them. It's kind of like a little self-insurance program within our company. We believe that all Missourians should have quality, affordable health care, and health care no matter where they live or how much money they make. We want choices between quality public options and private options. 3 times a year I go to DC to talk about legislative issues, and we've heard from Charlie Cook, who met with the auto industry, and when the auto industry met with former President Bush said, "I'd like to help you, what can I do to help you?" And the auto industry said back to President Bush, "Do something about health care. Health care is strangling the economy of our country." So it's not just small businesses, it's a big concern for small businesses, but it's also our entire economy is being strangled by the cost of health care. And not getting the results that we should get for the money we spend, in my personal view and my personal experience. So I want to thank you, Congressman Carnahan, for this leadership. Thank you for having this event, and thank you for hopefully moving this agenda forward in the United States, and it will support all small businesses and our economy and all of our citizens. Thank you very much.